Hello, my name is Kristen Pope, and I'm going to be speaking about measles today on behalf of the National Center for Immunization and Respiratory Diseases at the Centers for Disease Control and Prevention. Parents and caregivers should know that the measles, mumps, and rubella vaccination, otherwise known as MMR, is the most safe and effective way to prevent the measles. The first dose is given between 12 and 15 months, and the second dose is given between 4 to 6 years. With this vaccination, studies have shown that there is a small increased risk for febrile seizures during the 5 to 12 days after the first dose, and there is a slightly higher risk with the MMR plus varicella or MMRV vaccination. The CDC stresses that the risk is small. Only 8 in every 10,000 children will experience this. A febrile seizure is when a fever causes a child to have spasms or jerky movements, usually with a high fever of 102. Seizures usually last less than 2 minutes. So a febrile seizure is possible in any condition or illness that may cause a fever. Examples are colds, flus, ear infection, etc. However, on the flip side, it is likely that by vaccinating your child that you will prevent febrile seizures from occurring. Parents and caregivers should also be aware of the symptoms of measles. That includes rash, cough, runny nose, eye irritation, and fever. Serious complications include ear infection, pneumonia, seizures, brain damage, and death. Pneumonia is the most common cause of death of young children with measles. 1 in every 20 gets pneumonia. Another severe complication with measles is encephalitis, which is swelling of the brain. This happens in about 1 in every 1,000 children with measles. So encephalitis of the brain leads to convulsions, which can lead to deafness or intellectual disability. Some clinical features of the measles are that it is an acute viral respiratory illness, high fever and malaise, 3 C's, which are cough, coryza, and conjunctivitis. A rash appears usually 14 days after exposure, and a person is contagious 4 days prior to the rash and also 4 days after the rash. Those who are at high risk for measles include infants and children 5 years or younger, adults 20 years or older, expecting women. Pregnant women with measles may give birth prematurely or have a low birth weight, and also individuals with a compromised immune system, such as those with HIV or leukemia.